Hello, my name is Ashley Williams. I am the IT manager for Marie Healthcare Clinics. We are the second largest dialysis clinic in the Southeast United States. We have over 200 clinics in 7 states, and those states are Mississippi, Alabama, Arkansas, Florida, Louisiana, Georgia, Tennessee. With that being said, we also offer dialysis. We are a dialysis clinic. We offer dialysis services to our patients for their kidneys to be cleaned. We also have home health services that we provide throughout these 7 states. Those home health meaning that some patients are on home dialysis, which is called hemodialysis, where they have to be they place themselves on the machine and cleanse their blood as well. We send nurses, doctors out to them to check on them throughout the weeks. We also provide chaplain services, Bible study through our chaplains, who are all volunteers. As well as that, we also provide counseling sessions for our families as well as the patient, because once a patient has been told they have to be placed on dialysis, it's not just a life-changing event for that patient, it also involves their family. And with that being said, I actually decided that when my mother was placed on dialysis years ago, back in '07, it really would have helped if we had a sort of say counselor or person to come in and intervene to let us know this is what's going to happen, this is how we're going to prepare for it. And being ill prepared really makes it hard on a family once that patient has passed on or got even sicker. So we decided at Marie, that's the name of our clinic, that we wanted to be that home type of family environmental clinic, as well as we also offer CPR classes for the patient or for the family in case that patient goes home and something happens at home. We give them the proper training that they need to help that member. We also provide training as far as most kidney patients also have diabetes, so we provide diabetic classes to teach them about the different things that may occur, weaknesses, what to look for if that person get ill or sick. We also as well provide, kind of like an all-around clinic in one, everything in one clinic. So we also provide a nutritional class, so because when you get on dialysis, it's not just a life-changing event for that patient, it's also a life-changing event when their family has to change. And a dialysis patient having to eat one thing and then the family is sitting there eating something else is not fair to that patient. So with these classes, that helps so that everybody's on one page, everybody's on one accord. So our company, like I said, we have we're in 7 different states, 200 facilities, hoping to open more. But we have doctors, nurses that are in our clinics every day that rotate between the clinic on some days, and then on other days they're either off or they may rotate out on the fields where they have to go to the home and help those patients. One of our biggest problems that when we first started up was not being able to service everybody in a particular area. So that was very challenging for us. As an IT manager, I had to go and make sure that, okay, if this person is not getting the help that they needed, that even if we didn't offer that help, maybe we could get somebody to, or get them to a clinic that would provide for them so that they wouldn't get sick. Because if a person needing dialysis don't have the proper care, the proper facility, they're either going to end up in the hospital or they're going to be deceased. So as a IT manager, not only provide making sure that they're okay, but we've also faced some challenges of not having enough staff. Like I said, when we first started, and not just enough staff, but making sure that our employees know that they're not just an employee. We have training, we offer incentives, different pay scales for if a person really love their job. We also have sort of say parties just to feel so that not only them, we provide they are that support for that dialysis patient, as well as not just the challenges of keeping employees, but keeping a sane mind, because dealing with a person that really wants to just, if they look at that machine, they may want to say, hey, I don't want to deal with this anymore. I don't want to live. I don't want to be a burden on my family. So with that being said, that's when the chaplains come in, and we have volunteer chaplains now, because it was hard to get a minister or a pastor to come in and talk, because some people can't even stomach walking into a dialysis clinic. So with that being said, we decided to go out into the field and out into the community and ask, hey, have you had a patient or a person that's been on dialysis, or been needing something, a diabetic that needs that extra care, or a person that's got chronic illnesses, having to know or learn what I need to do, where do I need to go, how can I help. And so that's what we did. We went out in the community and asked, can you please help? We need help at our clinic. And we had pastors to come and ministers to come and say, hey, how about offering a Bible study to those people that are on the machine, and they're sitting there watching the machine, looking at their blood running through, being cleansed. How about we do a Bible study while they're doing the clinic, so while they're doing the treatment. So we decided to do that, and that really has helped. As well as our counselors offer sessions for the patient's family, getting them to understand what is about to happen to that person's life. So with that being said, there are many issues, many problems that occur, and as an IT manager, you got to make sure you're on top of the game. You stay ahead, you stay on the road, you stay focused on what you need to do. So being that Marie Healthcare Clinics really provides for the community, and that's why we are the second largest facility in the Southeast. Thank you.